I'd like to offer Sanders Amendment number 203.
I'm sorry, what is that?
203, Sanders Amendment.
Sorry, Sanders Amendment number 203.
Yep.
Thank you. Ready? Go ahead.
Chairman, obviously there are a lot of differences of opinion on a lot of issues in this bill. I would honestly hope that there will not be differences of opinion on this one, because I know that every member of this committee is strongly in opposition to any kind of fraud and wants to do everything that we can to cut back on fraud, which is costing our nation and individuals and companies substantial sums of money. What this amendment does is provides explicitly that payments made by, through, or in connection with a gateway are subject to the False Claims Act, and, in addition, authorizes up to double the existing, which is treble damages for false claim violations. And what this means is that a prosecutor could seek and/or a judge could impose up to 6 times, but no less than 3 times, damages in these cases. And the reason that I'm offering this amendment is that, having done a little bit of work in studying fraud in the healthcare industry, and it's certainly not just Medicare and Medicaid, it exists throughout the private sector as well, private insurance companies, is that I worry very much that if you are a major multinational corporation that plays with billions and billions of dollars, getting hit with treble damages may well be worth it and passed along as a cost of doing business. A couple of points that I want to make on fraud. First of all, we talk about Medicaid fraud, we talk about Medicare fraud. Let's understand, we talk about fraud in general against Blue Cross Blue Shield. What we're talking about is fraud being perpetrated against these institutions, not by these institutions. And one of the things that we have discovered, which many of you may or may not know, is that almost every major private entity in the pharmaceutical industry, in private health insurance, and in the private hospital world, chain world, has in fact engaged in fraud. Now, whether this is a bad apple operating improperly, or whether this is to some degree systemic, I don't know. But I think what we have to tell, especially these large multinational corporations, that if they are going to commit fraud, they're going to pay dearly for it, and we have to provide a strong disincentive for them to be continuing fraudulent action. And let me just give you briefly some examples of what's going on. This is just a few. In 2004, Warner Lambert, a division of Pfizer, pled guilty to 2 felonies and agreed to pay $430 million to settle charges. In 2002, Pfizer agreed to pay $49 million to settle charges that it defrauded the Medicaid program. In 2008, Johnson & Johnson was taken to court by the Texas Attorney General with charging that they were funneling kickbacks to Texas health officials, and that charges there are still pending. In 2003, GlaxoSmithKline signed a corporate integrity agreement and paid $88 million in civil fines for overcharging Medicaid. In 1999, Hoffman LaRoche agreed to plead guilty and pay a $500 million criminal fine for leading a worldwide conspiracy to raise and fix prices regarding vitamins. In 2009, Sanofi-Aventis acknowledged that it violated the False Claims Act by misrepresenting drug prices and paid $95 million to the Medicaid drug rebate program. Just this year, the U.S. government and 16 states have joined in 2 whistleblower suits against pharmaceutical giant Wyeth. The drug company allegedly failed to pay hundreds of millions in rebates to the Medicaid programs. That's just the drug companies. Then you go to the private health insurance companies. United Health, in 2009, paid $350 million to settle lawsuits brought by the EMA, state medical societies, doctors, and patients. In 2008, the New York State Attorney General announced that he intended to file suit against United Health, its subsidiary Ingenex, and 3 additional subsidiaries for a scheme to defraud consumers by manipulating reasonable and customary rates. In 2009, WellPoint, which is a huge insurance company, was barred from bringing in new patients in the Medicare Part D and Medicare Advantage program because WellPoint has, quote, demonstrated a long-standing and persistent failure to comply with CMS requirements for proper administration of its Medicare Advantage drug program, etc. In 2003, Aetna agreed to settle a class action brought by physicians by paying $470 million and overhauling business practices. In 2003, Cigna paid $24.5 million to settle allegations in terms of Medicare fraud. In 1999, Hospital Corporation of America agreed to pay $745 million to settle civil charges that it systemically defrauded Medicare. Tenet, in 2003, I think they're the second largest private healthcare chain, hospital chain, paid $54 million in fines. In 2006, Tenet agreed to pay $725 million in cash and give up $175 million in fees because they were overbilling Medicare claims. And on and on, and I won't bore you with more and more of these stories. But what you have time after time after time is not just little fly-by-night operations selling wheelchairs to people who aren't alive or don't need it, or selling other medical devices. You have large, major, multinational corporations. And I fear, I don't know for a fact, that this in fact may be the tip of the iceberg, that if we're more vigorous, as I hope we will be, in prosecuting fraud, we'll go after these guys, so more vigorously. So bottom line here is what we are doing is saying that what the amendment does is provides explicitly that payments made by, through, or in connection with the gateway are subject to the False Claims Act, which we don't say clearly. And second of all, it doubles the damage from 3 times to up to 6 times. So I would hope that we could have strong support for this amendment.
For the debate, Tom?
Mr. Chairman, I'm supportive of this amendment. I think Senator Sanders is on to something. The pain for defrauding and the ease. Medicare is easy to defraud. It's designed to be that way. Same with Medicaid. I think the amendment will send a good message. It means corporate responsibility, whether it's individual actor or corporate policy, has to be attentive to it. And so I would just offer my support for his amendment.
Thank you, Senator. Is there further discussion on this? Mike?
Mr. Chairman, I support it too. I wonder if we could expand it